Diabetes is a chronic condition in which your body is not able to utilize glucose as a source of energy. It is a long-term condition, it's a chronic condition, and it is important to deal with this condition because without appropriate control, you can experience complications of diabetes. Type 2 diabetes is because of two main reasons. One is insulin resistance and the second is insulin production. Insulin resistance is when your pancreas is producing some insulin, but that insulin is meeting a lot of resistance and is not able to work properly. The production is when your pancreas struggles to produce enough insulin in response to the increasing glucose levels. So this is the reason why people get type 2 diabetes, problems with production or problems with resistance, and sometimes both. Type 1 diabetes is an autoimmune condition in which your own body starts producing antibodies which damage the pancreas, and as a result the pancreas is not able to produce enough insulin. Type 1 diabetes, the patients usually need to go on insulin as soon as they are diagnosed. The third type is the gestational type of diabetes, which is common in women after 20 weeks of pregnancy. This is because in pregnancy your body becomes extremely insulin resistant, and as a result pregnant women develop diabetes. The risk factors are different for each type of diabetes. Number one, type 1 diabetes, there are no risk factors. The reason why people get type 1 diabetes is not known. It is assumed that it is all bad luck. There is no one particular reason as to why people develop type 1 diabetes. Type 2 diabetes, there are certain risk factors. The most important risk factor is family history. So if either of your parents or grandparents or siblings have type 2 diabetes, then your risk is significantly increased. The other risk factors are being overweight or obese, sedentary lifestyle, smoking. For gestational diabetes, increasing maternal age, so women who get pregnant after the age of 30, family history of diabetes. These are the two conditions in which women may develop gestational diabetes. Type 1 diabetes, because there are no risk factors, unfortunately you cannot prevent it. So we will concentrate on this question predominantly for type 2 diabetes. Now, as I said, the most important risk factor for a person to develop type 2 diabetes is family history. And unfortunately, that is something we cannot change. It would be wrong to say if you've got genes to develop type 2 diabetes that you can prevent it. What you can do is delay it. If you've got genetic code to develop type 2 diabetes, then no matter what you do, you will develop type 2 diabetes. However, when you develop type 2 diabetes is in your hands. Family history is very, very important. If you have family history and if you are at risk, then what you can do is you can delay the onset of type 2 diabetes. Instead of getting it in your 30s or 40s, you may get it on your 40s or 50s or 60s by doing things right. If you do not have a family history of diabetes, then trying to maintain a good diet, a good lifestyle, a normal body mass index is the way to go forward. It is very important for you to understand that the complications of diabetes happen because your sugar levels remain high for prolonged periods of time. So if you can control the sugar levels, then you may not get complications. Now, what are the complications if your glucose levels remain high in your blood? Lose weight, you lose muscle. In the long run, it can affect your eyes, it can affect your kidneys, you can get problems with the nerves in your feet. Further complications include heart attacks and strokes. So these are the major complications of type 2 diabetes. What is also important is for young people, and that is erectile dysfunction. So your sexual life may be impacted if your glucose levels remain high.